I specialize in adult hip and knee replacement. Really, we're trying to help people with arthritis in their joints that have pain limiting the activities in which they can participate. One of the things that sets us apart is we really try to have the patient understand the entirety of their clinical picture and their diagnosis. I really want them to also understand the various treatment options available for it so that we can best make the decision to get them back to the things that they want to do. I think as a new patient, it's really important to not just understand the specific reason you came in, but if there's any other issues that potentially could be contributing to it. I try to look at the patient as a whole so you kind of can understand what parts may be coming from your primary complaint or if there's other areas of the body or reasons you might be having that pain. A lot of times it's pretty normal to have a little anxiety on the first patient visit, and I think what's really important is trying to make the connection with them just as a person as well, and trying to have them comfortable with you, as well as trying to make sure all of their questions are fully answered. And I think going through that, listening to them and taking the time really helps that personal connection and makes people comfortable going forward. For hip and knee replacement, there's a lot of different ways to go about it, different technologies. I've had a pretty good experience in a multitude of those. We do use robotics for quite a bit of our hip and knee replacements, as well as being comfortable in many different approaches to the hip. Although robotics isn't required for every patient, I do think that it can be very helpful, especially for select patients. There's some deformities that can be more challenging manually and that you can plan for with robotic surgery. I also think that it allows for a little more precision in the OR and reproducibility to give a similar result. The thing that I really enjoy is the feedback that I get from patients in clinic, where they really are appreciative of the time spent with them. And also when patients have a really positive surgical outcome and they're able to get back to the things that they enjoy, time with their family, and return to their hobbies and enjoy their retirement.